guys, welcome back to my channel. I actually just got my tripod in for my car. Why does it look like you're sideways? Tripod in for my car, and obviously, as you can tell, I'm still trying to figure it out. And right now I'm going to go get some copy paper. I need to print off my notes, so I'm going to Walmart and I'm just testing this out. I feel like this would be so helpful. The reason why I got a tripod is because I feel like it'd be so helpful when I'm on my way to school, on my way home from school, on my way to the hospital, on my way home from the hospital. I feel like a lot of the time when I'm like in school or at the hospital, I'm like, oh my god, I want to make sure to talk about this when I, you know, like on my channel, and I don't get to because I either forget or something happens or blah blah blah, and then I forget to talk about it. So I figured it'd be great to get a car tripod just because it also gives a change of scenery. I feel like all my videos have been in my room lately and it's like driving me insane. So we will see how this looks. If it looks great, I'm gonna continue doing stuff like this. And I feel like it's just so much easier to kind of take you guys around with me. But yeah, so we'll see how this works. Let me know if you guys enjoy this. I've been looking at tripods for some time just because I want something a little sturdy, and this is supposed to be really sturdy, but I see you shaking, so it's kind of making me a little upset. I don't know if I didn't tighten it enough or what, but yeah, we're gonna have to make it work. So yeah, Walmart is like literally 3 seconds away from my house, so I'm already at Walmart. I think I'm gonna record a more realistic week in my life. I let you guys know on my Instagram post that I was planning on doing a more realistic and a kind of more personal day in my life, just because lately I feel like I've been doing more structured videos and I enjoy having different content on my channel. I enjoy, you know, showing you guys a little bit more rather than me just sitting down talking to you guys. I just got to Walmart. But yeah, so I'm gonna test this out. I asked you guys on my Instagram, which if you guys haven't followed me, it's Nursing with Jackie. I just made it last week, and I decided to make that kind of like my nursing Instagram, so I can kind of show you guys a little bit more. As you guys, if you guys wanted a more structured videos, if you guys wanted more everyday, go with the flow type of videos, because lately I have been doing a lot of structured videos where I sit down, know what I'm talking about, and it's just like, you know what I mean, like kind of like straightforward. And I feel like when I first started my channel, it was more like talking to you guys like you guys were with me, and I feel like that's kind of just more a little bit more personal. So I want to do that again, so that's why I decided to get this tripod. Why am I explaining this for so long? But yeah, so we're gonna test out this video. I don't know if I'm gonna get a week's worth or if it's gonna be a weekend or what it's gonna be, but yeah, so right now I'm gonna go ahead and go inside Walmart and get a few things. Hey guys, as you can tell, I'm now back home. That first clip was kind of, I know it was kind of like weird that I was like in the car driving and introducing the video, but that's kind of just gonna be the trial of my little tripod. Right now I need to like print off all my notes. I don't know if you can tell like the mess that's in front of me. As you can tell, my bed's not made. Like this is literally like me being as real as it gets. I don't fix my bed every single day. I like to fix my bed, especially like during the week. Weekends, I'm not really worried about it. Yeah, I mean, it's real life, you know? If you fix your bed every morning, kudos to you, but I don't fix my bed every single morning. But yeah, so right now I'm just gonna print off my notes and stuff like that. And when I say this is gonna be realistic, this is gonna be realistic. So this semester, they kind of did something a little bit different. So every single semester, we have our 12-hour clinicals, and we have like clinical assignments, but our clinical assignments are just like concept maps or care plans. And then sometimes we'll have an essay due. So that's normally what we do in clinical. But this semester, what they decided to do is include this thing called CAIs, which is called Computer Assisted Instruction. So they basically give us like a list, as you can see. Like if you could see all that, these are different videos, HESI case studies, HESI patient reviews, ATI videos that we can do. And what she wants us to have, or what our school wants us to have, is 10 hours of additional supplemental instruction in addition to our clinical. So I've been working on this. I have 2 hours done, which isn't enough. I have to do a total of 10 hours. It says 6 hours due by week 7, which is in 2 weeks. So I have 2 hours ready, and I'll probably knock out another 2 today. But if you guys remember my last video, I talked to you guys about the Medcom videos. So it's actually pretty cool. I was actually pretty like annoyed when our instructor was talking about how we have to do 10 hours of additional videos and HESI case studies and ATI stuff, because it is kind of like assignments and it takes so much time for you to do it. So yeah, and then our instructor could also see specifically how much time we actually spent on it. That's kind of what I've been working on. I'm probably gonna do a couple more hours of that. Tomorrow I have lecture, so I do want to make sure to go over the material. I told you guys in my last video that this instructor this semester is like adamant on us reading ahead, because throughout the class, like she'll ask us questions and she'll even have like little quizzes at the end of class where like she'll like separate all of us. So like we will all be in the middle, and then there'll be an A, B, C, D section on each corner of the room. And then she asks the question up on the board, and then you walk silently to whichever answer choice you think is correct. So she kind of quizzes us. Not only that, she'll like literally walk around and be like, what is the answer to this? And like all that. Another thing that I got to do today is also, she's been giving us crossword puzzles, and we had some time to work on it in class. This is one. It's pain management. This is the one that she said she's gonna ask us on. That she's gonna test us on, and she'll literally like go around the room and ask everybody to give the answer to it. So I gotta work on that. So that's what I'm gonna be working on today. It seems like a lot, but it is 3 o'clock in the afternoon, so I do got a lot of time. But yeah, so that's what I'm gonna be doing today. Oh, another thing, I wanted to talk to you guys about my experience in OB at the hospital. So my first day at the hospital was actually last Thursday, my first official day. The day before that, the week before that, we did orientation, but it's orientation, so whatever. So my instructor kind of tells us which section that you're gonna go to in the hospital, or what area you're gonna be in. So there's labor and delivery, let me show you guys so you guys can see it. So the different sections that my instructor is gonna send us to, like I'll read off my specific schedule, because everybody kind of has a different schedule. So the first week I was in resource newborn, which is where I was last week. This upcoming week I'll be in the NICU, then I'll be in mother baby postpartum, then I'll be in mother baby, then I'll be in labor and delivery. Yeah, those are going to be the different sections that we are allowed to go to. So when I was in the resource newborn, which you guys are probably like, what the heck does that mean? I had no idea what it meant. So the resource newborn nurse is actually the nurse that's there to assist in labor and deliveries. Like she's there every single time a delivery is made, whether it's a C-section, vaginal birth, anything like that. She's actually gonna be the first nurse there, and she helps prepare the newborn. So I got to be a part of 2 C-sections, which was honestly so amazing. It was my first time watching a birth. I've never had any friends or family give birth, and I've been there. So this was like me starting off with a very clean slate. I've never had a kid, anything like that. So when we got to see the 2 C-sections, so we kind of, my nurse got a report on all the patients that we were, that were gonna give birth, while she was there. So the first patient was a C-section, and she was a scheduled C-section because she had a C-section for her first kid. So of course they like to do repeat C-sections. If you've had a baby and you've had a C-section, they like to do repeated C-sections after that. But of course it depends on types, the way that they cut you and all that stuff. I haven't learned all that yet, so I'm not gonna speak about that because I'm not an expert, and I'm not gonna be giving you guys false information. So I just know that that's usually how they like to do it. They like to do repeated C-sections if you've already had a C-section. So walk into the OR room. This is actually my second time in the OR, and the room is always like super clean and white, just like you see in all the movies. So we walk in, and I'm with my nurse, and what she's in charge of doing is, like I told you guys, she prepares the warmer. She's gonna be the person that gets the newborn. She dries off the newborn and cleans him up. She takes his Apgar at 1 minute, Apgar at 5 minutes. She's in charge of giving him his shot. Every baby gets a vitamin K shot as soon as they're born. And then they also get the erythromycin ointment on their eyes. So we got to do that, and then we got to do a quick little newborn assessment, which was really cool. We do that for Apgar, and then in addition to that, we do that to make sure that the baby comes out okay. So we do a brief little newborn assessment, and then we basically got the baby ready to give to mom. The first patient that I had, she wanted to do skin to skin in the OR, which was of course amazing. In the hospital, they have this thing called the golden hour, and that means that first hour that the baby's born, they want to have that on mama's chest, and they want to have the baby breastfeed if mom is planning on breastfeeding. So that was like so cool to see, and that mom specifically said, I want to have skin to skin in the OR. Apparently her husband or boyfriend told me that the first time they requested that, they weren't able to get that skin to skin. So she had requested that, so we got the baby all ready. The actual C-section itself was insane. I got to see two spinals where they give spinal anesthesia, so it kind of just numbs everything. That was really cool to see. And then I got to watch them clean with the chlorhexidine, And but yeah, mom is basically awake the entire time. Once they have the room entirely set up, like they have mom numb, she's laying down and they're literally getting ready to make the incision. They call dad in, and then dad comes in and dad sits right next to mom. He comforts her throughout the entire C-section, and I was actually reading in my book that it's been proven to help decrease mom's anxiety. So that's why they have dad in. And of course, dad comes in full PPE as well. Both of the C-sections that I saw were actually repeated C-sections, so they would just cut straight into that same scar. And then they were telling me that while they were kind of like opening it up and like burning into the skin, like they showed me all the scar tissue, which was really cool to see. And then once they get to the muscle, this is where like it killed me. So like everything else is kind of standard, they cut open, whatever. Like I've seen that already, and you probably have seen that on YouTube or like anywhere else. Once they get to the muscle, they make a tiny tear. Okay, so they cut the muscle about this much. And then there's 2 doctors on each side, okay? One doctor grabs one side of that tiny little tear, other doctor grabs another side of that tiny tear, and each doctor pulls and literally rips apart the abdominal muscle to get to the uterus. Like, when I say rips, like you can hear the skin tearing. Not the skin, you could hear the muscle tearing. And that was probably like the most cringy part. I mean, I enjoyed it, but my classmate who's had a C-section, she's like, I can't believe that's what they did to me. I didn't even know that that's what they do. And we were like so amazed. Like you'd think that they would just cut the abdominal muscle. And I can't remember exactly why they do that tearing rather than the cutting. My instructor tried explaining it to us, but I don't really remember what she said. I think she said that it doesn't heal properly if you cut it. It heals properly if it is torn. So they tore it apart, and then when they get to the uterus, it's kind of like a purple, you get to see like a purple little ball. They got to the uterus, and then once they get to the uterus, they kind of get this huge plastic wrap and they put it all around mom. And it's kind of like a little plastic, it's a huge plastic, but then it has like little, oh my God, it has like little pockets all around the corners of the plastic wrap. And then once they tear into the uterus, water breaks, blood gushes absolutely everywhere. Like it's like a waterfall of water and blood. Okay, so that happens. And then after that, they cut open into the uterus. And one of the doctors, once they cut a good space into the uterus, I think they cut about that much, if I am remembering properly. And then one of the doctors pushes hard on mom's belly, and you saw the little head just bloop, pop out right out of the uterus. And then right after you see that little head pop up, of course they suction his mouth and his nose because they want him to breathe, they want him to start crying, you know? So they clear his secretions, and then they pulled up the baby by his head. So you literally like saw one of the doctors just pull the baby right out. And that's exactly how they did the C-section. So I got to see that 2 times while I was in the OR. I don't know if I even explained that in a really good way. I hope I did. I feel like it makes sense in my head because I'm visualizing it, but if it just didn't make sense, I can make a whole new video on it. I don't really know. I just kind of wanted to talk to you guys about it. But yeah, it was like so cool. So that's what we got to do. I got to do last week in the OR, and then this week I'm actually gonna be in the NICU, and I heard in the NICU you don't really get to do much, but I'm not sure. It kind of depends. The person that was in the NICU last week, she said that she didn't really get to do much, and she didn't get to do any of her assessments. That's another thing. I wanted to do my newborn assessment, and I also wanted to give the vitamin K shot, and I wanted to give the erythromycin ointment. But the first baby that I saw, like, keep in mind, like, the entire day, my nurse is planning on being on this unit and, like, going to see all these labors and to be there to assist for all of them. And actually, right after that first C-section, we got called off into triage, which is, like, OB/ER. And we got called off over there, and there was just moms that are, one of them was a 26-week-old mom that was having horrible abdominal pain. Another one was a 40-week mom that was having blood that was bleeding. That's what she was there for. And we were called off of the unit for about 4 hours, and I literally wanted to cry so bad because I wanted to do my newborn assessment, and I also wanted to do, I wanted to give vitamin K, and I wanted to give the erythromycin ointment just so that I can get my med administration out of the way as well. But I wasn't able to, which was so sad. And my nurse was like so sorry. She's like, I'm so sorry that they called us over here. And I'm like, oh, it's fine. It's of course not your fault. You're doing your job. They needed help over in triage, so called us over there, and that was like so boring. That was so boring. It was, I mean, both patients were thankfully stable, of course, but because of that, it was just like, I didn't really get to do much. A lot of the time that I was there, my nurse was charting and there was no seat for me to sit. So I was literally standing up for like 4 hours, just like walking around. And I had nothing to fill out because I'm like, I still have to do my newborn assessment. Hopefully we get sent back. And I kind of asked my nurse, like, do you think we're gonna be able to get sent back to over to labor and delivery? And she said, well, I don't know, it kind of depends. So I had nothing written down for the day, and my teacher expects us to have a concept map completely complete. And then we also have to do a newborn assessment, which I could show you guys what the newborn assessment paper looks like. So this is the concept map that we have to have ready at the end of the day. It's just a basic concept map. It includes concepts, labs, assessment, finding meds, evaluation, teaching, risk factors, and then your nursing diagnosis, your goal, and 3 interventions. And then I actually used up a newborn assessment, so I don't have one, but here's a postpartum assessment. So each assessment paper that we have to complete for the day depends on what area we're in. So since I was with the resource newborn nurse and I was gonna be around newborns all day, my teacher wanted me to complete a newborn assessment I had already prepared for, and unfortunately didn't get to do, no matter how hard I tried. But yeah, this is kind of what our assessment paper looks like. This is a postpartum assessment, so it's kind of just, how do I even explain it? It's kind of just like a normal SBAR paper, but it's just broken down into specifically for postpartum, specifically for newborn, specifically for, the other one is postpartum, newborn, and what's the other one? I can't remember what the other one is for. But yeah, so that's what we have to complete every single day in class. And yeah, I feel like this is like all over the place. So that's what I got to do my first day in OB. They actually did end up sending us back to labor and delivery, but when we got back from labor and delivery, we had another C-section, so we got to see the C-section, and this was around 2:30. Keep in mind, we go to post conference at 3:30, okay? Around 2:30, we got sent back, and then we had another C-section, so we had to be in the room, and you guys, like, I literally finished that C-section, which was really similar to the first one. Thank God, really healthy baby. APGAR scores were 8 and 9 for each of the C-sections that we were in, which is really high, which is really good. That means they're really, really healthy babies. And I had a patient that actually just gave birth, and she didn't want to have her baby on her chest anymore. She wanted to have her in the warmer. And I took that opportunity as soon as she said that, and I messaged my instructor and I told her, hey, I have a baby, I could do my newborn assessment. And then as soon as I went into the room to let mom know that we were gonna do a newborn assessment and to place the baby into the warmer, she's like, actually, I think I wanna breastfeed. So of course we're gonna have mom breastfeed. That's that golden hour that I talked to you guys about. Like, that's what we want mom to do. We want mom to have baby on her chest as long as possible. We also want her to breastfeed if she can, or if she will, if she's planning on breastfeeding. So of course, as soon as she said I wanna breastfeed, newborn assessment thrown out the window, so that's not important at all compared to baby breastfeeding. So at that point I called my nurse in, and she kind of helped the baby latch on and kind of taught mom how to breastfeed since it was her first child. But I basically didn't get to do anything. I had to really quickly fill out my newborn assessment based on that first baby that we got to see, and filled out all my paperwork, and I kind of just let my instructor know what was going on, and she already knew because I had told her earlier in the day. But yeah, so that's how my week was. I feel like I'm so all over the place. This is why I do more structured videos, okay? This is why. Okay guys, so I was actually planning on this being a week in my life, or a week in my school life, a weekend in my life, and then I looked at the footage and I just finished editing the footage and it's 20 minutes long. This is why I don't do week in my lives, because I talk so much. I just love explaining everything in detail. And I know that when I was in nursing school, like before I got into nursing school, I like knowing details, so I talk really detailed. Do you guys want me to like stop talking so in detail? Like, I hate cutting out information just because I feel like nursing students in general are like very detail oriented, like they love details, and you guys like knowing like as much as you can. So just let me know down below. Do I talk too much? Do I make my videos too long? I hope you guys enjoyed this video. Make sure you like it if you did. Make sure you subscribe if you haven't already, and I'll see you guys in the next video. Bye.